Today I am doing PDOs for a neck lift, and PDO stands for polydioxanone, and this is a material that surgeons use in the OR all the time, and they are threads that dissolve. But before they dissolve, they help lift and they will make you make collagen. So we are going to do a thread lift for our patient's neck. So I've already numbed her. Turn your head this way for me. Right in this little location right here. And I'm going to, can you feel here? Mm-mm. Okay, good answer. We're gonna do a little, make it a channel. This is what one looks like, just like so. And it is on a cannula. See if we can find our spot right here. There we go. Okay, a little pressure. Weird, weird, weird. It's so strange. Strangely weird. Okay, you okay? Mm-hmm. Okay. We're gonna keep going down from that same channel. And here we go. You okay? Mm-hmm. And there are different size threads for different areas. And I love the size. This size is great for the neck. And these are 21s. If you are a medical professional, they're 21 gauge, and they are 3.5 inches long. And they're on this blunt tip, which is nice because it helps decrease the risk of bruising. Even though bruises are complimentary here, I prefer them not to really happen. There we go. Beautiful. Okay. And we can really put these threads anywhere, which is great. Turn towards me for a sec. Beautiful. But this is a very popular place to put them, is the neck for the neck lift. But we can put them in your face, we can put them in your breasts, we can put them in your belly, we can put them above your knees, all sorts of places to help lift. And then again, they'll reposition your skin and then they'll make you make collagen, which is great. That entire time that they're in there. And they will just dissolve on their own. It's so much cute hair. And you don't have to do anything about it. And really, I haven't seen issues with allergies to these, because most people have had some kind of suture or something that they've had exposure. Okay. Mm-hmm. Yes, still. Sorry, I'm out. Let's see. Oh, that looks so good. Mm-hmm. They've had some kind of exposure to polydioxanone, so. They also come in larger sizes, so if you had thicker skin, like we're not doing the neck, or if we're doing your face, we can use a little thicker size, or we have also little baby threads where you can put them in the forehead to help raise the eyebrow or around the eyebrow. We can even pull up the eyebrow. So there's all sorts of things we can do with the threads. If you don't like filler, but you don't like your nasolabial folds, we could put threads there. If you don't like filler and you want to get some more volume in your lips, we can put them directly into your lips too. So there's all variety. Who knew? I did, but now you know too, and everybody that's listening. Yeah. Okay, how'd that feel? Are you okay? Mm-hmm. No problem, no issues?
No problem, no issues.
Okay, so we're gonna go to the other side, so I'll be right back.
Okay.
Beautiful. So afterwards, you're gonna wanna not do all the dance moves that you love to do, because you want these threads to really get surrounded by your skin. So no like whooshing of your neck back and forth, no flash dance motions. Oh. And
well, that ruins tonight.
yes, that ruins no flash dance, no funny dancing. But and then you may feel sore. That's okay. I mean, I am going through your skin. multiple times.
Little Tylenol will help. It's fine.
Tylenol will help. I would avoid the ibuprofen if you're getting bruising, if you see bruising. But really, the main place that people may bruise is over here, which your hair would clearly cover if you did. Because this is a blunt tip. So as I go through your skin, if I approach a vessel, typically it will just push that vessel aside as opposed to going through it because it's a blunt tip. So you can't, I can't puncture my glove with this because it's a blunt tip. I gotta go grab some more.
I have a question, doctor.
I'm ready.
What if you have filler and you also want to add this? Is that a combination that might work for
That's an
people?
excellent combination that would work for people.
You're
Yeah,
welcome.
very good. You can also do things like halo, BBL, light or laser treatments to make your skin healthier, add some volume with filler, and then reposition the skin with PDO threads. Blows your mind. But yeah, you can use this in combination. You can do these first, you can do these second. There's not a specific order that it must be done in, but everybody's a little different. So sometimes people have like an event coming up, and then I might tell you, okay, do the filler first, then do your PDO threads, or do your PDO threads first, then do your halo. So it just depends on your goals and what's coming up and why you're doing it. And
So coming in and talking with you and making a plan is really smart.
it's so smart.
That's what I hear you say.
Yes, you're so smart. And that way too, I can give you all the pre and post care. You can have all your questions answered. And you might feel little zingers, I call them, for the next couple days. Just as your tissue surrounds these threads, a little tiny superficial nerve might get irritated for a second, and you'll know it if you get it. Don't worry about it. It's not that all of a sudden something moved or anything like that. It's just the threads settling in. And you may also, like I said, be sore, you might get a bruise, but you know what, it's par for course, right?
Yep.
Putting all these things in your face or your neck at this point. Let me put a little arnica on you and we'll do this one more time, and then we're gonna sit up and look at it. Turn this way for me. And you might feel it clicking. You might not feel it clicking. But these are a wonderful little tool to not have to undergo a facelift, but it will give you lift. Okay, so let's.
And there's no downtime afterwards.
There's no downtime.
That's
You can
huge.
go out and do whatever you want tonight,
Not the dance moves.
except for the dance moves.
Heavens forbid,
Yes. No dance moves. So all I'm going to do is I'm just going to cut off just the little ends of these. Perfect. And we're going to tuck the very end under. And look, you can't even, nothing. You can see nothing. It's perfect. Does that feel so good?
So good. It actually doesn't hurt at all. It just feels like you're massaging my face.
Oh, good.
Thank you.
You're welcome. Lots of times people like the way it feels when they're pulling up because they're like, yes, this is exactly what I want. I want it to be pulled up. But, and sometimes when we do the neck, because it's such thin skin here, you may have some swelling. So that's okay. You can ice it. If you need to rub it just because you have to touch it for some reason, you want to rub up like this. We never want to pull our skin down. And so I think the best time to see this is in about a week when any swelling that was there is gone. And then when you look at your neck, you're going to go, oh wow, I look great. And then in a month, you're going to be like, wait a minute, I look better. And then in another month, better and better and better. So the entire time that they're in there, as they dissolve over the course of 1 year to 2 years, you're going to keep making collagen the entire time. So it's a procedure that keeps proceeding. That's what I always say. So you're welcome. So you can keep on thinking about me every time you look in the mirror and you go, I look amazing.
Thank you, Dr. Zietz.
Yes. So if you want to find out if PDO threads are right for you, you can find us online at RejuvenationMD.medspa.com.
And they are right for you.